Assalamu alaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. So today's video is on whooping cough disease. So this is an illness that can spread easily and is also known as pertussis. An infection of bacteria causes it from called Bordetella pertussis, and many people with the illness get a serious hacking cough. So breathing in after coughing often causes a high-pitched noise that sounds like a whoop. It usually occurs in children but can affect all ages. So once you become infected with whooping cough, it takes about 5 to 10 days for symptoms to start. Sometimes it takes up to 3 weeks. The symptoms are often mild at first and they can include a runny or stuffy nose, red watery eyes, fever, cough, vomiting, a red or blue face, extreme tiredness, a high-pitched whoop sound during the next breath of air. These last few symptoms usually occur after 1 or 2 weeks, where thick mucus builds up inside the airways and causes rapid coughing that can't be controlled. The cough can last for weeks or months and can be very intense at night. Caused by Bordetella pertussis, and when an infected person coughs or sneezes, tiny germ-filled droplets spray into the air. So anyone who happens to be nearby can breathe in the droplets, and the bacteria that cause the whooping cough also can spread when people are together for a long time. These germs can also spread when people share breathing space, such as while holding a newborn on your chest. Include bruised or cracked ribs, tissue that bulge through a weak spot in the muscle of the stomach, called an abnormal hernia, broken blood vessels in the skin or the whites of the eyes, loss of bladder control, weight loss or fainting. So the best way to prevent whooping cough is with the pertussis vaccine. It's often given together with vaccines against two other serious diseases, diphtheria and tetanus. So a vaccine is a series of 5 shots, so it's usually called DTAP, and it's given to children at the ages 2 months, 4 months, 6 months, 15 to 8 months, 4 to 6 years. There are side effects which include fever, crankiness, headache, fatigue, or soreness at the site of the shot. Diagnosis: a nose or throat culture and test. So a mucus sample from the back of the throat where the nose and throat meet. Samples then checked for signs of whooping cough bacteria. Blood tests: a blood sample can be taken and sent to a lab. The lab checks for certain proteins called antibodies, which the body makes to fight infections. So this is a general test that is not specific for the whooping cough. And also a chest x-ray, which can be recommended to check for signs of pneumonia due to the whooping cough. Tests are done, such as a bacterial culture test. So this test is most accurate when it's done during the first 2 weeks after coughing begins. So a fluid sample is sent to a lab and cells in the sample are grown until they're enough to test. Sample is then checked for whooping cough bacteria and the results can take 1 week to come. PCR is also done when it's done in the first 4 weeks after coughing begins. So this checks for genetic material from whooping cough bacteria. Results can be ready within 2 hours. There's also nasal aspirate or wash, so you'll get a saline solution inserted into your nose and removed with gentle suction, and a swab test where a special swab is used to take a sample deep within your nose. So for the treatment, you can have antibiotics which kill the bacteria that cause whooping cough. This include azithromycin and clarithromycin. So when you take them early, they can make your illness less serious. They shorten the amount of time you're at risk of spreading the illness. If you live with other people, they can be given antibiotics also to prevent them from getting sick. There isn't much available to relieve the cough itself, and cough medicines that are sold without a prescription are quite ineffective and they don't really help with whooping cough. So antibiotics are the key here, and as I said, the main ones are azithromycin and clarithromycin.